My name is Leah Morris, and gangrene is the skin condition that I researched. Gangrene is a condition that occurs when body tissue dies. It is caused by a loss of blood supply due to an underlying illness, injury, and/or infection. Fingers, toes, and limbs are most often affected, but gangrene can also occur inside of the body, damaging organs and muscles. There are different types of gangrene, and all require immediate medical attention. The two major types of gangrene are dry and wet gangrene. Dry gangrene is from conditions that reduce or block arterial blood flow, such as diabetes, arteriosclerosis, tobacco addiction, trauma, frostbite, or injury, while wet gangrene is from the same causes as dry gangrene, but it always includes infection. In some cases of wet gangrene, the initial cause is considered to be the infection. So, blood plays a very important role in your health. It not only helps transport oxygen and nutrients throughout your body to feed cells, but it also delivers disease-fighting antibodies that protect your body from infection. When blood cannot travel freely throughout the body, your cells cannot survive. Infection can develop and tissue can die from gangrene. Any condition that affects blood flow increases your risk of gangrene, including diabetes, atherosclerosis, peripheral arterial disease, smoking, trauma or serious injury, obesity, weakened immune system. Some signs and symptoms of gangrene are dry and shriveled skin that changes from blue to black, cold and numb skin, pain, swelling at the site of infection, a change in skin color from red to brown to black, blisters or sores that produce a bad smelling discharge, fever and feeling unwell, a crackling noise that comes from the affected area when pressed. If tissue obtains good oxygenation by adequate arterial blood flow and does not become infected, then both dry and wet gangrene can be prevented. Avoiding tobacco use and avoiding external trauma like frostbite can help prevent gangrene. Treatment for all cases of gangrene usually involves surgery, medical treatment, supportive care, and occasionally rehabilitation. When surgery is used to treat gangrene, they will remove dead tissue and sometimes amputate a limb in order to prevent the spread of infection. Antibiotics are also used to treat and prevent infections. Before the introduction of antibiotics, fly maggots were commonly used to treat chronic wounds or ulcers. These maggots were utilized to remove the necrotic tissue without harming the healthy living tissue. This practice largely died out after the introduction of antibiotics and enzymes as acceptable treatments for surgical, chronic, and traumatic or accidental wounds. Recently, however, maggot therapy has regained some credibility and is sometimes employed with great efficacy in cases of chronic tissue necrosis and gangrene infection. The quality of life of a person with gangrene would be fairly poor. A person with gangrene would have pain, odor, and difficulty with mobility. Gangrene might also impact a person's social life, as they would be self-conscious of the smell and looks of their condition. And that is my presentation on gangrene.